Hi, good morning. This is Dr. Ayyappan Nair, and today I'll be discussing about a topic. Uh, this is normally a question most of the patients ask me, especially if they have a tear in the shoulder. And the first question most of my patients ask is, Doctor, is there any way other than surgery to fix my muscle tear? So I always tell them it is not that surgery is required for all patients, and I'm very choosy regarding my surgical option, and I don't always tell surgery for all my patients. If a patient can be managed or treated completely with without surgery, then I always do that, because nobody wants to get under the knife, and always we get the best results in the correct indications. So here was a young person, a 25-year-old male patient, okay, who likes to do bodybuilding, who always goes to gym. So he was doing a overhead lift, and he had a injury to the shoulder. There was a small tear in the muscles called as a rotator cuff. So rotator cuff is a group of four muscles which help in rotating and moving the shoulder, and also help in. We have done something called as a PRP injection, where we take blood. In the blood, there are three different types of cells: RBC, WBC, and the platelets. The platelets have got healing potential, and under ultrasound guidance, so this is injected. So this blood is taken. We isolate the PRP. So the PRP is for platelet rich plasma, where the platelets are concentrated to a higher number. This picture shows how the PRP is prepared, how it is centrifuged. And so that we take in a syringe, and under ultrasound guidance, we inject this into the partially torn rotator cuff, partially torn tendon. So this is ideal in traumatic tears, in traumatic rather than degenerative tears. And so that means if you have a trauma and if it's a very small tear, definitely there are good results. And it is not like all patients do respond to it. Most of the patients, so majority of the patients do respond to this, and in a month time with good therapy, the patients are pretty good, and we can manage without surgery. So this is the PRP injection or conservative management for small traumatic tears in the rotator cuff or in the shoulder. You can see this video now where you can see the needle being put into the shoulder. On top of the cuff, you can see that needle there. That moving thing is a needle. So it is inside the torn tendon area, which we had isolated with the help of the ultrasound scan, and we're just slowly injecting in the PRP. So it's a very simple process and not very painful, and takes a few minutes to be done, and the patient can be discharged on OPD basis.